My name is Emily Essendi. I'm going to do a presentation about how wound care quality directly impacts patient safety and recovery time. Over 10.5 million people in the US suffer from chronic wounds annually, and poor wound management increases infection, sepsis, and amputation risks. Chronic wound costs the U.S. healthcare system an estimated of $25 billion annually. Inadequate training leads to inconsistent care and preventable complications. Technology-based education helps reduce variability in wound care delivery. So wound care is a significant concern in clinical practice, and the cost of chronic wound care exceeds as I said, the $25 billion annually. According to CEN in 2023, despite the importance, training in wound care often varies across teams and locations, leading to inconsistent practices and suboptimal patient outcomes. Using innovative technology-driven education can help standardize knowledge and improve the quality and safety of care provided. The aim is to identify three or more common chronic wound types, demonstrate accurate assessment using evidence-based tools, and apply standardized care protocols in simulated settings. Participants will also learn to recognize early signs of infection and respond appropriately. Informatics tools will be introduced to enhance wound documentation. Finally, the session will guide staff in evaluation. The education plan will integrate diverse instructions methods to address multiple learning styles. Avatar-led tutorials will visually demonstrate wound care tutorials with techniques in a clear step-by-step format. Learners will engage with virtual patient simulations that replicate real-life clinical situations. Enhancing critical thinking, e-learning modules will support self-directed learning at a flexible pace. To strengthen retention, the program will include quizzes and interactive games. Live webinars will connect staff with wound care experts, while discussing forums will foster peer collaboration and knowledge sharing. Successful implementation requires both tools and support. So we will use trusted platforms such as Hydrogen for avatar content, Body Interact for virtual simulations, and Medscape of nursing modules. Together, these resources will help us build an effective, tech-driven learning environment that promotes professional growth and patient safety. We will also follow a 12-week timeline to ensure thorough development of testing weeks. 1 to 2 weeks will involve aligning objectives and gaining stakeholders' feedback. In weeks 3 and 4, the focus will shift to content development and platform setup. So the IT will conduct testing, followed by training of facilitators and clinical-based pilot. In week 7 and 8, after analyzing pilot results, we will refine and launch the full program by week 12. Continuous monitoring and quarterly updates will ensure ongoing improvement and sustainability. To ensure success of education plan despite challenges, We have developed a strong continent strategy backup training modules in PDF format. We will be available in case of platform issues. In person simulation kits after a hands-on, alternative deadlines may be extended if issues arise. We will partner with the vendor to provide round-the-clock technical support. A clear information technology escalation path as said. Wound care in a nutshell. Wound care. Enhancing wound care through innovative education is essential to improving patient outcomes and reducing preventable complications. Traditional training methods often lead to inconsistencies, but with tools like virtual simulation and avatar-guided modules, we can standardize care delivery across the system. The plan includes robust evaluation and continuous feedback mechanism to ensure effectiveness. Ultimately, this initiative equips clinicians with the skills and confidence needed to provide high-quality evidence-based wound care that promotes healing and patient well-being. Thank you.